Breathing. Medical viewpoint. The primary role of breathing in gas exchange. Our cells need oxygen and their waste product, carbon dioxide, needs to be expelled. Breathing is an automatic body function, controlled by the respiratory center of the brain. However, we can also deliberately change our rate of breathing. Different healing systems from different cultures have long realized the healing benefits of the breath, including yoga, Tai Chi, and some forms of meditation. Many holistic practitioners believe that the breath is the link between the physical body and the ethereal mind, and spiritual insight is possible through conscious breathing. Regardless of the philosophy, scientific studies have shown that correct breathing can help to manage stress and stress-related conditions by soothing the autonomic nervous system. Stress can be managed and reduced with proper breathing. Shallow breathing is a typical stress response. Hyperventilation can prolong anxiety and stress. Abdominal breathing techniques soothe the nervous system and encourage health benefits such as reduced blood pressure. The use of controlled breathing as a means of promoting relaxation can help to manage a range of disorders, including anxiety, asthma, chronic fatigue syndrome, chronic pain, high blood pressure, insomnia, panic attacks, some skin conditions such as eczema, and stress. To stay inflated, the lungs rely on a vacuum inside the chest. The diaphragm is a sheet of muscle slung underneath the lungs. When we breathe, the diaphragm contracts and relaxes. This change in pressure means that air is sucked into the lungs on inhalation and pushed out of the lungs on exhalation. The intercostal muscles between the ribs help to change the internal pressure by lifting and relaxing the rib cage in the rhythm with the diaphragm. Flexing the diaphragm requires the use of the lower abdominal. If one's abdomen gently moves in and out while he breathes, then he is breathing correctly. Furthermore, the brain sets the breathing rate according to carbon dioxide levels rather than oxygen levels. When a person is under stress, his breathing pattern changes. Typically, an anxious person takes small and shallow breaths, using his shoulders rather than his diaphragm to move air in and out of his lungs. This style of breathing empties too much carbon dioxide out of the blood and changes the body's balance of gases. Shallow overbreathing or hyperventilation can prolong feelings of anxiety by exacerbating physical symptoms of stress, including chest tightness, constant fatigue, faintness and lightheadedness, feelings of panic, headaches, heart palpitations, insomnia, muscular aches, twitches or stiffness, and tingling numb cold hands and face. Moreover, when a person is relaxed, his breathing nasal is slow, even, and gentle. Deliberately mimicking a relaxed breathing pattern seems to calm the autonomic nervous system, which governs involuntary bodily functions. Physiological changes through relaxed breathing can include lowered blood pressure and heart rate, reduced amounts of stress hormones, reduced lactic acid buildup in muscle tissue, balanced levels of oxygen and carbon dioxide in the blood, improved immune system functioning, increased physical energy, and manifesting a feeling of calmness and well-being. There are different breathing techniques to bring about relaxation. In essence, The journal aim is to shift from upper chest breathing to abdominal breathing. Take notice of how your upper chest and abdomen are moving while you breathe. Concentrate on your breath and try to breathe in and out gently through the nose. Your upper chest and stomach should be still, allowing the diaphragm to work more efficiently with your abdomen and less with your chest. With each breath, allow any tension in your body to slip away. Once you're breathing slowly with your abdomen, sit quietly and enjoy the sensation of physical relaxation. One must remember, shallow upper chest breathing is a part of typical stress response. The stress response can be switched off by consciously breathing with the diaphragm. Abdominal breathing plugs into the autonomic nervous system and encourages it to relax, bringing a range of health benefits.